Funding for AARP Alaska comes from the State of Alaska Division of Banking and Securities, Senior Citizen Support Services, and AARP. In today's program, we'll learn all about Medicare Parts A, B, and C. Now here's your host, Ann Secrest.
Hello everyone and welcome to AARP Alaska. Today our guest is Jeanne Larson, Health Program Associate with Alaska's Medicare Information Office. Jeanne, thank you so much for joining us today.
Thank you so much for having me, Ann.
If you would, tell us a little bit about yourself. How long have you been with the Medicare Information Office?
Yes, well, I've been with the Medicare Information Office for going on 9 years now. I am born and raised Alaskan, and basically that's what I am, is an Alaskan helping Alaskans navigate Medicare.
I'll tell you, Alaskans are in good hands with you there at that office.
Thank you.
A lot of information. Tell us about the Medicare Getting Started. What is this program?
Medicare Getting Started is a PowerPoint presentation that was created by the Centers for Medicare and Medicaid Services. It's primarily focused on helping Medicare beneficiaries and persons getting ready to enroll in Medicare. So we're looking at the baby boomer population, the 62, 63, 64-year-olds who need to know about all the important decisions around Medicare. The timing to enroll, maybe delaying Medicare because of working or a spouse working, or even signing up at the right times to avoid late enrollment. So helping people navigate Medicare and understand when to enroll and maybe when to postpone.
Now you basically have two programs under one roof. We've got a little slide here, the State Health Insurance Program and the Senior Medicare Patrol. Tell us about the two programs.
Well, the State Health Insurance Program is also referred to as the SHIP program. And that's a grant through the Centers for Medicare and Medicaid Services, Administration on Community Living. And that's to help people, their family members, caregivers, anybody who's on Medicare or getting ready for Medicare, empower them to understand the different parts and do outreach in the communities to help people understand what parts of Medicare they might need. And we do so by hiring and training local boots on the ground volunteers to be the access for Medicare information in their communities. So this SMP, or Senior Medicare Patrol, is the second federal grant that we get through our office, and that's to empower retired volunteer professionals to help people understand how to reduce and target fraud, waste, abuse, and errors in the Medicare and Medicaid programs. So we also recruit and train volunteers to help people understand how we can reduce and prevent fraud in the Medicare and Medicaid systems.
How would you describe the goal of your office?
Basically, we're Alaskans helping Alaskans understand Medicare. We want to help people navigate the different choices that might impact their insurance coverage, finances, and by having this Medicare Information Office, we are local people who are on the telephone, available by email, navigating Medicare, taking the maze out of Medicare, helping them to understand it better, because it can be quite difficult with all that insurance jargon.
It sure can. Now in this program, we're going to look at Medicare Parts A, B, and C, and in our second program, we're going to look at Medicare Part D, Medigap, Medicaid, and getting extra help for paying for prescription drugs. So let's start with, what is Medicare?
Right. Well, Medicare is health insurance. Basically, the federal health insurance program, most people qualify for Medicare at age 65, and that's referred to as age-at Medicare. And that's about 80% of the population. 20% of the population qualifies for Medicare due to disability. So that's persons that are actually labeled disabled by the Social Security Administration and receive something called SSDI, Social Security Disability Insurance. And those are payments that they receive because Social Security thinks that they are unable to work for at least 12 months or have some kind of medical condition that will eventually result in their death. That's Social Security's definition of disability. So if they get disability payments for 2 years, they become eligible for Medicare. And any age persons with end-stage renal disease, which is also referred to as ESRD, and that's permanent kidney failure that requires dialysis or transplant.
Who runs Medicare? Who runs the program?
Medicare is administered by the Centers for Medicare and Medicaid Services. You'll hear this referred to as CMS. But the Social Security Administration is actually the agency responsible for enrollment. And few people who are retired through the Federal Railroad actually do the enrollment through something called the Railroad Retirement Board. So administered by CMS, but enrollment done by Social Security or the Railroad Retirement Board.
What are the numbers here in the state of Alaska?
The numbers as far as Medicare beneficiaries, right now there's probably about 77,000 persons on Medicare in Alaska.
Let's take a look at the 4 parts of Medicare. We have a little slide up.
The 4 parts of Medicare, this is basically Medicare alphabet soup. They're all letters of the alphabet. Part A is the hospital insurance. This is your inpatient coverage. Part B is the medical insurance. This is your outpatient service. Part C is Medicare Advantage plans. These are private health insurance companies that take over all your Medicare. It's your Medicare under one roof through a private insurance company. And then within those Advantage plans, you can also have Medicare Part D, which is my favorite because you can actually say D like drug coverage. So those are the 4 main parts of Medicare that may or may not be available depending on where you live.
Is Medicare Part C, is that the same as an HMO?
It is. Actually, there's many different options under Medicare Advantage. You might have an HMO, which is a health maintenance organization. You might have a PPO, which is a preferred provider organization. And sometimes you might see special needs plans that focus on a particular type of person, like a low income or a special needs.
All right, enrolling in Medicare, easy or hard?
Well, that depends upon the situation. For most people, there's the capability of enrolling online through Social Security's website, which is the socialsecurity.gov. Most people are able to enroll online. Some people are not, don't really want to do the enrollment on the computer or are not able to enroll online because perhaps they don't qualify for the part of Medicare Part A that enables them to do the enrollment online. So if they have to deal with Social Security by telephone or in person, they have to sign up by making an appointment with the Social Security Administration. So sometimes that means waiting on hold for Social Security to get through, which can often take a little while.
And the initial, let's talk about the initial enrollment period package. Mailed 3 months before age 65, includes a Medicare card, and as you mentioned, the disability, 25th month of disability benefits as well.
Correct. Some people, Medicare enrollment is automatic because they're getting a Social Security benefit or they are getting a railroad retirement benefit. If a person's enrollment is automatic, they get an initial enrollment package about 3 months before their Medicare goes into effect. And in that enrollment package is the information that they need to read through very carefully, which gives them information about if they want to keep their Medicare, sign their Medicare card, put it in a safe place. If they want to refuse Medicare, sign the card and send it back to the address indicated. And we'll talk a little bit more about why a person may want to refuse Medicare.
All right, we've got a graphic here of a Medicare card, front and back. Talk about the information that is contained on a person's Medicare card.
Sure. The Medicare card is actually the identification that shows if a person has Medicare Part A hospital and or Part B medical insurance. And it's very important to keep that card in a safe place because it has someone's social security number on that card. And it's also got a letter indicating how a person is getting Medicare, or if they're getting it under their own work record or a spouse's work record. So it could be their own social security number on the card, it could be their spouse's, followed by a letter. It doesn't indicate what part of Medicare a person has, whether they have Part A or B. It's simply telling us how they get their Medicare, under their own record or their spouse's, if it's a previous spouse or a deceased spouse. Most importantly, persons need to look at that Medicare card, make sure their name is spelled correctly, and put it in a safe place, because that card is very valuable, like a credit card, for fraudsters.
Is there anything on the back of the card that is important that may surprise people?
The back of the card can look a little different. If a person is enrolled automatically, the back of the card has directions on how to refuse Medicare. If a person does not want to accept Medicare, they follow the directions on the back. If a person did their own enrollment into Medicare, it simply has some information about how to contact 1-800-MEDICARE, and it'll look a little different for people who are automatically enrolled versus people who do enrollment on their own.
What is your view on carrying your card in your wallet?
We encourage, the Medicare Information Office encourages persons to only carry their Medicare card when they are going to go see their doctor or their health professional, and otherwise keep it in a safe place and not carry it in their wallet at all times, because that card is actually used to perpetrate Medicare fraud. People steal those cards and use a person's identity to access medical services, or fraudulent billing can happen if a fraudster gets their hands on that Medicare number. So we do encourage people to sometimes even make a copy and black out the social security number on the card, because if you're in an emergency and the ambulance provider is looking for your Medicare number, they're going to have means of finding it. And it's better to be safe than sorry.
Is Medicare fraud a problem here in the state?
Fortunately, it's not a huge problem. We are not a fraud hotspot in Alaska. We practice prevention here, though, telling people to read their statements that they get from Medicare in the mail and make sure that they know what's going on with their health care dollars, because the beneficiaries and family members of Medicare are the front lines in reducing and targeting fraud.
And again, just make sure, in other words, that if they went to the doctor on March 3rd, that indeed that's what shows up on their explanation of benefits.
Correct. The most important and vital thing a person can do to make sure to watch out for Medicare fraud is reading what's called your Medicare summary notice, which is a list of everything that Medicare processes and pays or denies, and making sure that those encounters actually did happen.
So keep a calendar.
Correct.
Wonderful. We'll be back with our guest, Jeanne Larson, right after this break.
Alaska's Medicare Information Office is Alaskans helping Alaskans get more out of their Medicare. They provide one-on-one counseling to Medicare beneficiaries and their families. They also teach how to spot and report Medicare errors, waste, and fraud. Call toll-free 1-800-478-6065 or in Anchorage 269-3680.
We're back with Jeanne Larson, Health Program Associate with Alaska's Medicare Information Office. And Jeanne, I want to make sure I understand, is enrollment automatic with Medicare?
Not necessarily. Some people are automatically enrolled because they're getting Social Security retirement benefits or Social Security disability benefits. So when a person is getting a benefit from Social Security, they actually did their Medicare application when they filed for those benefits. But for some people, the process is not automatic. Okay. And it would be the person's responsibility to contact the Social Security Administration. The government doesn't send them a birthday letter or come knocking on their door and tell you, hey, it's time to enroll in Medicare. They have to take action on their own and do so by contacting Social Security, either applying online at the Social Security website or calling the national toll-free phone number for the Social Security Administration, or even going to a local field office and contacting Social Security. And we recommend at the Medicare Information Office that they do so about 3 months prior to their 65th birthday month.
Got it. It is a little confusing when, I'll pick on myself, I won't be eligible for retirement until I'm past 66.
Correct.
But then I'll be eligible for Medicare at 65. So it's a little confusing, and of course, retirement, that age is increasing.
Correct. So when we look at Social Security benefits versus Medicare, it used to be that everything went hand in hand. A person stopped working, retired at 65,
Right.
signed up for Medicare and Social Security benefits. But those things have changed now. Medicare eligibility age is still 65, though full retirement age, when a person can get their maximum Social Security benefit without any reductions, can vary based on a person's year of birth.
Right.
So some people's full retirement age might be 66, for others it might be 67. So you don't have to be retired to still be eligible for Medicare at 65. It makes it easier because your Medicare premiums can be deducted from your retirement benefits.
Got
but
it.
many people wait until age 70 even to grow that Social Security retirement benefit.
Let's look at when and how to enroll in Medicare. And as you mentioned, visit your local Social Security office, call the toll-free number, or visit the website.
Correct. Again, Social Security is the agency that handles that enrollment. Most people can go online and easily enroll in Medicare only at the Social Security webpage, or enroll in both Social Security benefits and Medicare at the same time. So there's two different options. If a person is not computer savvy and they don't want to use the online enrollment tool, they can contact the toll-free telephone number for Social Security. The national phone number probably has the longest hours, which is 7 a.m. to 7 p.m. in all time zones. So that is nice for
Wonderful.
Alaskans.
And when to enroll, as you mentioned, you don't have to be retired. Your initial enrollment period lasts 7 months, begins 3 months before your 65th birthday, includes the month you turn 65, ends 3 months after you turn 65. And as you mentioned, there may be other times you may enroll.
Correct. The initial enrollment period is the time when a person is first aging into Medicare at 65, or graduating into Medicare, as we like to say. And that period begins, it's a 7-month window around your birth month, the 3 months before, the month of, and 3 months after your birthday month. And so making sure that you enroll at the right time can also determine when your Medicare becomes effective. So if you want Medicare to start as soon as possible, you really want to start working in those 3 months prior to your 65th birth month.
Very good. All right, original Medicare. What is original Medicare?
Original Medicare is the term used to refer to the national federally facilitated health insurance. So that's the Part A hospital and the Part B medical. And that is available anywhere in the nation and follows you anywhere in the nation as long as you use a Medicare doctor and facility. So it's transferable. Part A is the hospital insurance, and that part covers your inpatient services. So when we refer to original Part A, we're speaking of inpatient hospital benefits when you're formally admitted to the hospital, skilled nursing facility care, so if you need to go into a skilled facility for additional services following a hospital stay, Part A would also be responsible for those benefits. Home health care benefits, if you need care at home that requires a skilled professional, like medical services, physical therapy services at your home, that would be also under Part A. And hospice care for end of life, when you are expected to live 6 months or less as certified by a doctor. Mm-hmm. Those are all your Part A inpatient hospital benefits.
Got it. And then Part B, the medical insurance. Under original Medicare, we've got doctor's services, outpatient medical and surgical services, supplies, clinical lab tests, durable medical equipment, and preventive services.
Correct. If a person has Medicare Part B, those are the services that fall under Part B. And that would be outpatient emergency room care, ambulatory surgical centers, if you need physical therapy, also the durable medical equipment. That's the term that speaks to hospital beds, wheelchairs, walkers, diabetic supplies, the testing supplies fall under Part B. And preventive services, that's a wonderful benefit under Medicare. Preventive services are now a zero deductible, zero out-of-pocket cost under Medicare. So there's no additional cost with those preventive services.
Does that include like a yearly exam?
There is a Welcome to Medicare physical exam, which is basically a conversation with your doctor about your working health systems and other preventive services you may want to access. And then there's an annual wellness visit, which means you can have that same conversation with your doctor each year on Medicare.
Wonderful. And that's new. I mean, that's been a change.
Correct. Those benefits, the annual wellness visit and Welcome to Medicare exam, were both added a couple of years ago.
All right, let's look at paying for Medicare Part A. What does Part A cost?
Well, for most people, Medicare Part A is premium free because while working in the United States and paying what's called FICA taxes, Federal Income Contributions Act, persons will actually see this listed as Medicare if they look at their pay stub from work. And that's taxes that earn us Medicare Part A premium free. So we're actually paying for these costs while working and paying taxes. And it takes about 10 years for a person to work in the United States and earn enough what the Social Security Administration will refer to as credits or quarters of work to get Part A premium free. And even if a person doesn't have sufficient work history in the United States, they may be able to still get Part A, perhaps if they file under a spouse's record. So maybe they had a spouse that worked enough and they apply under the spouse's work history. Or if they don't have anyone else that they can apply under, a person can just opt to buy the Part A. And that premium can differ based on if a person has any kind of work history, then they might have a reduced premium for Part A. If they have absolutely no work history and no other person to file for Part A, then they can pay a full cost for it.
Got it. And we've got the Social Security toll-free number up for individuals if they wanted to call.
Correct.
Paying for Part B. In original Medicare, you paid monthly premium, yearly deductible, and 20% co-insurance for most services. There is help for individuals if they need help with
Correct.
Part B.
Correct. Medicare Part B, most people do have that monthly premium, the amount that they pay just to have the coverage. And if a person has limited income and assets, there are programs to assist with the cost of that premium as well as the other costs a person might pay. There's a deductible, a yearly dollar amount a person pays out of pocket before they get the benefit of insurance, and also a co-insurance, which is a percentage of the cost of the bill. Medicare, for most services under Part B, usually pays about 80% of an approved amount, and then the patient has the remaining 20% usually to pay.
How should I keep or sign up for Part B? How do I know if I should sign up or keep?
Well, everybody's situation is different, and if they have health insurance through active employment or a spouse's active employment, they may want to consider delaying Part B, because if they have good health insurance, why pay that premium for Part B if you've already got good health insurance? And that's actually the time that Medicare will allow you to defer and not be penalized for late enrollment. Some people might be required to take Medicare Part B, and that can all be looked at based on if they have other health insurance. So maybe they might have a retirement plan that requires them to sign up for Medicare. If they have, some retirement plans have language that say you must elect Medicare at age 65. Somebody might like their employer plan, but it might cost too much money, and they might want to go with Medicare to avoid a higher cost.
What if they don't have coverage from active employment.
If they don't have health insurance through active employment or a spouse's active employment, then they would definitely want to consider signing up for Part B.
Okay.
Not only to have health insurance, but if they don't sign up when first eligible, they might pay a higher premium for late enrollment.
In the minute we have left here, I wanted to talk about Medicare Part C, Medicare Advantage.
Well, that's pretty easy because in Alaska, it hasn't recently been available. Medicare Part C is health insurance through private insurance companies. So rather than the federal government administering the plans, they're administered by private insurance companies. But unfortunately, we haven't seen those catch on in Alaska, so it hasn't been an option available here. We may see them come back in the future, but persons should just check with the Medicare Information Office to see what's available.
Speaking of the Medicare Information Office, I want to put a slide up that contains all your information, including the Alaska Helpline toll-free number, and the general email address is there. I want to thank our guest, Jeanne Larson with Alaska's Medicare Information Office. AARP is a nonprofit, nonpartisan member organization with more than 90,000 members in Alaska. AARP is dedicated to enhancing the quality of life for all as we age. We lead positive social change and deliver value to our members through information, advocacy, and service. Thank you for watching AARP Alaska.
Funding for AARP Alaska comes from the State of Alaska Division of Banking and Securities, Senior Citizen Support Services, and AARP.